Scott from Scott New System, and you may recognize our guest today, Bob Cowrie from NMAP, from Area Agency on Aging of Western Michigan. He has been on before, and thank you for coming again today.
Yeah, you're welcome, Scott. Happy to be here.
Yeah. And how did you get involved as advocate for NMAP?
So the MAP program, Michigan Medicare Medicaid Assistance Program. So we help answer all types of Medicare questions for beneficiaries. So how did I get involved with this group? So it actually started back with I was working on my social work degree. We had to do an internship at the end of our studies before we graduated. And at that time, I was still working. I was working with youth in a juvenile detention setting. So for my internship, I wanted to flip to the other end, work with older adults. I like policy information. Um, Health systems were growing big in the area, so those were my three main topic areas, and MAP fit all those. We help answer people's policy questions, with understanding Medicare benefits. So finding out the different rules and coverages and so all that kind of stuff. So that's how I got involved with MAP as an internship, and I've been here ever since. So we're pushing 10 years now with the program.
Wow. And just out of curiosity, do other area agencies in other parts of the country have similar programs in case somebody was watching outside the Michigan area?
Sure, yeah. So MAP, we are what's called the State Health Insurance Assistance Program for the state of Michigan. So it's SHIP for short, sort of like a boat ship. So every state has a program just like ours. So we have sister programs in all 50 states. Many of them are located within state government, so either in departments of insurances or in the aging. So across the country, we have our programs are with many area agencies on aging, not all, but usually you want to be looking for wherever the SHIP program is. For Medicare beneficiaries, they get a Medicare and U-Book each year, and then on the back cover, it's going to have a phone number for their local state program. So that's the easiest way to get in touch with your local program, wherever you are.
So don't throw that away too fast, folks.
Correct. Yep.
Myself included, unfortunately.
Well, hey, if you ever need a coaster, sometimes a book works as a good coaster. If you have a hard time going to sleep, that's a good way to put you out too. So multiple purposes. So.
Yeah. Okay. In case they did disregard it a little too quickly, is there a way to get another copy of that booklet or anything? Or
Yeah, I mean, people can call our program. They can call Area Agency on Aging of Western Michigan. And I have a couple boxes of these books, all the time. So I'm always giving them out to everybody.
Okay. Well, that's good to know in case somebody put in file 13 a little prematurely.
Yep.
And before we get into our questions, go ahead and give us an overview of the differences between Medicare and Medicaid.
Sure. Yeah. Big question that we run into quite a bit. So Medicare. So this is a program that focuses on a couple main populations. One is people who are over the age of 65. So no matter what, any citizen in this country, once they hit age 65, they become Medicare eligible. So Medicare, it's just like any other health insurance that's out there. There are a couple different parts to it. Part A covers primarily hospitalization. Part B, all your other medical services, so outpatient services, lab work, x-ray. Part D, those are prescription plans. Part C, those are advantage plans. And then there are also supplement plans. So Medicare insurance for either those over the age of 65, or if you happen to receive Social Security disability benefits, so
That would be my
SSDI.
category. Yeah.
Yep. So after 2 years of receiving Social Security disability, SSDI specifically, you automatically become Medicare eligible. And so Medicare would be your primary health insurance at that point. So that's the 5,000-foot view of what Medicare is. Medicaid, on the other hand, Medicaid, here in the state of Michigan, we have over 30 different Medicaid programs. So we have a ton of different categories that people can qualify for. But Medicaid primarily is insurance programs for most of them are for people who have low income, low asset situations. So specifically for Medicare beneficiaries, the Medicaid program called Medicare Savings Program, there are income and asset limits in order to qualify for Medicaid benefits. We also have a couple different long-term care Medicaid programs, and they have their own income and asset limits for those programs. Plus, you have to meet a certain level of care need for those programs. So Medicare, you qualify either based on age or disability. Medicaid, you have to meet some type of income, asset, financial requirement typically. So that's the difference between the two programs. People can have both. So you could be on disability, you could be over 65, and because of your financial situation, you could qualify for Medicaid.
That's where I fall. Yeah, I'm dual eligible.
Yep. That's the common term for people who qualify for both Medicare and Medicaid is dual eligible. Medicare is going to be the primary insurance, and Medicaid acts as a secondary. People who are dual eligible, sometimes they'll think that, well, I have Medicaid, why would I want to sign up for Medicare? Again, Medicaid, being that they're the payer of last resort, they require that if you qualify for any other insurance, that insurance pays first. So if you are dual eligible, you have to have your Medicare benefits for Medicaid to pay anything. So Medicare pays first, Medicaid would pay second.
Yeah, basically, to make it as simple as possible, that is because Medicare is a federal, funding, where Medicaid is state. And of course, the federal level has more funding available, at least in theory.
Yeah. Yep. Yes.
Our Social Security is supposed to go up significantly this coming year, 2022, like 5.9% or something like that. In turn, is our premiums going to go up as well for Medicare?
Good question. Usually, because right now we're approaching mid-November, and that is when Medicare releases their numbers for the next calendar year.
Okay.
So we don't know yet what the Medicare Part B premium is, but no, my comment on that. So the calculation for cost of living and the calculation,
COLA.
yep, and the calculation for Part B, they're independent of each other.
Okay.
Even though many times it's very similar, that COLA goes up a certain amount and the Part B goes up a certain amount. But they are calculated independently. I just hope that Part B premium doesn't go up a whole lot so people can actually have an increase in income with their Social Security. So
well, I guess that would explain why I couldn't find the numbers.
Yep. I checked. Did I check this morning yet? I can't remember. I know yesterday afternoon I didn't see them yet. So anytime, anytime in
Okay.
mid-November. So
Okay. Medicare open enrollment time. What does this mean for people that have Medicare?
yeah. So if you turn the TV on, you open your mailbox, any type of stuff. I mean, you are bombarded with information on
Yeah,
Medicare this time of year. So
I figure it's about every other commercial TV wise.
yep. So yeah, it's Medicare open enrollment time. So what that means for people who have Medicare is that if you have a prescription Part D plan or if you have a Medicare Advantage plan, those plans are allowed to change their coverages for the next calendar year. So they'll change the medications that they cover. They change their formularies, so their list of meds, what the category is for the medication. They'll change their pharmacies, who they work with, who's preferred and standard. They'll change premiums and copays for all different stuff. And so in the fall, from October 15 to December 7 is the time where you can sit down and check out what your current coverage is going to look like next year. And if you see that there's something better, now is your chance to make that change. Um, because for many people, once December 7th rolls around, the last day, once you hit December 8th, you might not be able to make another change for the next year. So I was seeing some pretty amazing statistics about a week ago where like 80 to 90% of people never review their plans for the next year. So yeah, there are some policies that don't make a whole lot of change, but we run into enough situations come January where people all of a sudden go to the pharmacy and hey, I have to pay, $200 for this medication. Why am I having to do that? Well, the plan doesn't cover it anymore. Well, what can we do to fix it? Like, well, you're going to pay full cost and come back in the fall, and then we'll review plans then and make a plan change. So,
Ouch.
um, yep, you know, January, those are my list of things I don't like having to talk to people about. That's up there. Um, so yeah, a lot of people we meet with, they end up staying with their current plan, and that's great because at least they've done the research. They know that their policy is going to be good. They have the peace of mind that no big changes are happening, and the plan just rolls over. For all the other people, there's could be something better out there, better coverage, and so we can help them facilitate that plan change into something that's going to work for them next year.
So, from a strategic point of view, how would you recommend our viewers to go about making sure they're properly covered?
All types of different ways that you can do that. Usually in the month of September, the plans will send out the annual notice of change. So that's the first, really the first get to know what's going to be different for the next year. That's going to tell us when, different coverages are being made, if they're changing medication coverages. So that's the first thing to look at. You can go to plans websites. You can call plans up directly, ask them to double check medication costs. For our program and what our volunteers do, this is our busy time of the year. We talk to people all the time over the phone. Right now, we're actually meeting with some people in person. We'll sit down, we plug people's medications and pharmacies into the Medicare website. They have a plan finder tool on there that anybody can access. So we enter information in there, find out how good are the plans covering your medications, what the costs are. So our volunteers, we help do that for people all the time. So, or anybody can go on Medicare.gov and do that too. So they have some great tools on there to help review plan options.
Yeah. Yeah, last year where I ran into trouble was I tried a Advantage plan and found out my chiropractor was not a participant. So when you decide to switch to Advantage plan, I suppose you better make sure all your healthcare providers are a participant.
Yes. So in Medicare, you got two types of coverage that you can choose from. You can either go with traditional Medicare, where your Part A and Part B is primary. The vast majority of providers take traditional Medicare. And then with that, you'd select a Part D plan for your prescription coverage. The other route are the Medicare Advantage plans, and I commonly reference them as being replacement Medicare plans. So these Advantage plans, you still have to have Medicare Part A and Part B in order to sign up for these. But when you go with one of these private plans, Medicare A and B steps back. They don't provide any of the coverage. It's all managed by that private company. So, for example, here in Kent County, we have 7 different companies. So Priority Health, Blue Cross Blue Shield, Blue Care Network, Humana, Aetna. Those are a few of them. So with these Advantage plans, they have the same benefit as Medicare A and B, but they can set their own prices for services. They have the prescription coverage tied into each plan, so you don't have to pick a separate drug plan. You're actually prevented from doing that. But the big catch with these is they're HMOs and PPO plans, so they have provider networks. So before you go signing up for any one particular company, you want to double check to make sure that all your doctors, your hospitals, your pharmacy, whoever your providers are, that they work with that plan.
Yeah, that's probably where I made the mistake. I didn't check all the bases or what have you.
Yep, and it happens. We'll meet with people, and they'll forget about somebody that they see, and
Yeah.
it.
Well, I guess that's the forgiving grace of dual eligibility, being I was allowed to roll it back. But those who do not have dual eligibility don't have that luxury, correct?
So the only what I call a release valve. So if I sign up for a plan during the fall open enrollment, and come the first of the year, if that plan's not working for me, the only time you have that release valve is if you're with an Advantage plan. So if you're with an Advantage plan on January 1 of any given year, you'd qualify for what they call the Medicare Advantage open enrollment. So something specific for Advantage plans. Where January 1 through March 31, if you got into a plan that, maybe a doctor or other provider is not in network, you get one chance to change to something else in that time period. So
Okay.
it's not you're not totally forever locked in for the year with the Advantage plan. You do have that opportunity, but once you
Okay.
get past that March 31st date, you could be locked in.
Okay. Yeah. So I guess you would definitely want to have a service by your providers or confirm with them while you got that time period.
Yep, you betcha.
There are lots of ads on TV, phone and mail. Can you explain what these ads are talking about?
Oh, yes, this time of year, it is, and we kind of touched on this earlier, you cannot avoid all this Medicare advertising.
And
Um,
just from my perspective, where they talk about adding money back to your social security and calls, check your zip code. That almost sounds like a lottery program of some sort.
So yeah, we've been getting lots of calls from people who they see these commercials. They see, hey, I can get all these extra benefits. I can't remember the language they use, but I hear it frequently. I'm just checking to make sure I'm getting all the benefits that I'm deserved, or whatever the tagline is on one of those ads.
Yeah.
So really, what those commercials are advertising are the Medicare Advantage plans. Medicare Advantage plans have a long history of offering additional benefits that traditional Medicare does not offer. So, for example, your dental, your vision, and your hearing. Um, Traditional Medicare has no coverage for those types of services. However, the Advantage plans, they do have some of those benefits. What's included in each of those plans is typically preventative service. So, for example, with dental coverage, you're talking about checkups, you're talking about cleanings, and then maybe a set of x-ray once a year, every other year. That's what's going to be included in the plan. Maybe for vision, it's going to be an eye checkup and maybe $100 towards eyewear. Uh, so that's typically what we see that's included in the plans. And most of those plans, they also offer riders. So you pay an additional $20 or $30 premium per month, and you'll get $1,500 or $2,500 for extra dental service. So again, when you see those commercials, you think that, hey, all my dental services are going to be covered. Well, no, there are heavy restrictions on what's included with the plan. And if you want extended coverage, then you have to pay more per month. So it's not, the picture that they paint is not really what's going on with those plans. So people just need to be aware of that. In terms of the getting your money back into your Social Security. So back in 2018, I think it was, federal government expanded even more in what Advantage plans could offer for benefits. So transportation was expanded on. There's some food assistance that was expanded on, and being able to pay for the Part B premium, I think that was included in there too. So since 2018, we've seen these plans really expanding the benefits that they offer. However, not all plans offer those extra benefits. And this Part B back in your check is one of those benefits. Here in Kent County, out of the 35-ish Advantage plans that we have, there are only 2 that offer to pay you back some of your Part B premium. For one of the plans, they will pay you $90, I think it is. They're $99. And then the other plan, it's only $30. The problem with those 2 plans that I see is the level of coverage that's offered through the plan. One of those plans, none of our hospitals take it in Kent County. So yes, you
Oh
can sign up
my.
for that plan with that company, get that $100 back. But when you go to see the doctor or go to the hospital, the plan's not going to work for you. So that is a big concern that we see from our perspective. Plus, we get lots of calls from people who these brokerage firms that cold call people at home, or these ads on TV. People get enticed to signing up for these plans, and those companies might not thoroughly review with the person, who are your providers, what medications do you take, and so people just jump into these plans, and then all of a sudden they go to the hospital and the plan doesn't work there. So that's my concern with some of these ads on TV, and then with these different groups calling.
Well, I would think with our senior representative organizations, I would hope they would be a better watchdog, so we don't have so much misrepresentation.
Yep, and so I mean, when our program goes out and does outreach events or presentations such as this, we like to That's the avenue that I like to say is, hey, you see these commercials, they sound great, but it might not be all that it's made out to be. There's lots of bending of the truth with them at times. So just be careful and find somebody who can do the deep dive and to making sure that those plans are good for you.
People who qualify for Medicaid, care at Medicaid, are they any special plans for them? Other things to consider?
So people who have Medicare and Medicaid dual eligibles, there are some unique enrollment options, plan options for those beneficiaries. They have some plans that are called dual special needs plans, also DSNP, DNSP. So these plans are available for people who have Medicare and then a full Medicaid benefit. So these plans will wrap together the Medicare and Medicaid coverage into one. They're still considered Medicare Advantage plans. So they still have the prescription coverage tied in, and they still have your provider networks. So whether whichever one of these plans that you might be interested in, you still have to make sure that the plan that you sign up for works with all your providers. But these plans, they have the same Medicare benefits. For many times, a lot of the copays are zero, again, because the Medicaid steps in and pays that. Sometimes they'll be able to offer extra benefits that other Medicare beneficiaries don't have access to. There is a letter that the state of Michigan sends out about 5 times a year that's going to have a lot of these special needs plans listed on there. It actually has our program's phone number on the bottom of that letter. So if you ever have questions about that letter, you see MAP on there, you can give us a call. We can help explain those. But yeah, so they have these special needs plans that can be very beneficial for some beneficiaries. So again, the concerns that we see, the issues that we have people run into when they got signed up for one of these, they didn't do a prescription review, they didn't check their providers, and then so something's wrong. A medication's not being covered or the doctor visit's not being covered. So we can help people review, find a different one of those plans if it's going to be good, and then make a change. So
I guess the overall focus I get from this is we want to check our Part D the most right to make sure our providers for Part D have not changed their form or changed their formulary list.
Yep. Prescriptions. So those change. That's where we see the most change year to year is with prescription coverage. So whether you have the Part D or the Advantage, checking out that prescription coverage each year. So
Yeah.
yeah.
Yeah. I guess if you didn't want to change or whatever, the least amount you could do is check that.
Mm-hmm.
So you're not that person that you talked about earlier that goes first in the year and find out they're paying $200 out of pocket.
Yep. Yeah, I mean, every day I talk to 2 or 3 what I consider regulars, so people that search me out every fall to do plan reviews, and again, I'd say about half of them we don't have to make any plan changes. They come in, they give me a call, we review, and the coverages don't change at all, so they can stick with what they have. It's going to automatically roll over in the next year. For the other half of people, it's my medications changed, the pharmacy changed. Maybe they're seeing different doctors or whatnot, and we help facilitate those plan changes. So get them into something that's going to work for them.
Okay. And if people wish to contact, you said they can look at the bottom of their Medicare annual review booklet.
Yep. Yep. The main number for our program, it is 1-800-803-7174. Let's see here. Let's see if we can you see that okay?
Yeah, it looks pretty good here.
So 800-803-7174. And there's our main website too. So you can give us a call. You can also call your local area agency on aging. You just ask, say, hey, I need to do Medicare plan reviews, and they'll get you connected with our program. And it is a busy time of year for us. We are volunteer based, so it can take a few days in some situations for us to get back with people. So we're not like 1-800-Medicare where you can talk to somebody the same day. It could be a couple days before we can get back. So just be patient. We'll get back with everybody. So
Yeah, and I would definitely recommend our viewers to do it sooner than later so they are not caught in the pickle, and not be able to touch base before the enrollment period ends.
Yep. My normal suggestion is everybody should have this done by Thanksgiving. We do have 5, 6, 7 business days after Thanksgiving that we'll be making calls. So we have had a couple years where 3 days left in open enrollment, we're totally booked. And so if you wait till the very end, you may not be able to get in contact with us. We try to prevent that, but yeah, sooner the better.
Well, I got a feeling I'll be calling just to make sure I'm covered, much as I would like to think so. But that's where we get in trouble. I think we think the wrong thing or don't have all our information correct.
Yep. And again, you were mentioning too with, and I didn't really touch on this with dual eligible, is that there are special enrollment periods for you where you have the opportunity to change throughout the year. So for dual eligibles, people who have both Medicare and Medicaid, the pressure is not fully on for this time of year to make plan changes. But some people like having their stuff in place by January 1. So now is the time to change. So
Okay. So I guess we're not quite so much in a pressure cooker, but it certainly cannot hurt us.
yep. But you set a good example, Scott. So I know you'll be I know you'll be calling me soon. So
Yeah, you got to. Well, okay. Well, thanks again for coming, and I really appreciate it.
cool. Yeah, sounds good, Scott. Anytime.
Yeah. Thank you and take care.
All righty. You too.